Learning that a drug commonly used to treat heart failure is an effective therapy for a rare and aggressive form of endometrial cancer. At least that's according to a study from the University of Alberta. So in today's Health Watch, we're talking about Gynecologic Cancer Awareness Month. More than 100,000 women expected to be diagnosed this year, says the National Cancer Institute. So joining us now is Dr. Susan Reed, a gynecologic oncologist over at Skyridge Medical Center. Thank you for being here. We appreciate it. The National Research Institute, by the way, Susan, says that about 20,000 women will be diagnosed with ovarian cancer. September also Ovarian Cancer Awareness Month. Endometrial ovarian cancer is common. So the question is, how do women get them?
Well, there are multiple different causes. One cause for both endometrial and ovarian cancer is genetic predisposition. So all patients with ovarian cancer are always screened for a genetic cause so that if there's any family members that need additional screening, or if the patient also is predisposed to other cancers, that we can get them on that track to try and prevent other cancers in family members or in the patient themselves. For endometrial cancer, there's a lot of different factors. There is a genetic cause, but they also tend to come about because of excess estrogen exposure. So that means that patients who are obese, patients who have insulin resistance are also at increased risk of that cancer.
You mentioned screening. Can a pap test help screen for these types of cancers?
No, a pap smear test is only used for cervical cancer screening. Every once in a while, we do find an endometrial cancer that comes up on a pap smear, but that's not what they're designed for.
And when we talk about cancers in general, a lot of the talk comes about preventing cancers, right? Is there anything that we can do to prevent these types of cancers?
For endometrial cancer, a lot of it does have to do with maintaining a healthy lifestyle. So for patients, maintaining a normal body weight, maintaining a lower body fat percentage, and trying to avoid insulin resistance. There are patients that are predisposed to that, again, genetically, but that's the main prevention for endometrial cancer. For ovarian cancer, there's not as much that we know about that can provide prevention. Certainly, again, maintaining a healthy lifestyle, avoiding smoking is always going to be helpful.
One last question. We only have about 30 seconds, unfortunately, but how does this impact fertility and what other complications come about from this?
For patients that do have an early onset of these cancers, sometimes they do require surgery that unfortunately takes away their fertility. We also know that there is some link between infertility and some of these cancers, but it's a multifactorial issue, and we're not exactly sure at this time what all of those links are.
Okay, thank you so much, Dr. Reed. We always appreciate it. And by the way, you can watch all of our health interviews on our website at cbscolorado.com.